The primary care centre is the hub of the health service. It's our first port of call when we're not feeling well. It's also the busiest department in the hospital. It's not always the easiest to get an appointment here. New measures being introduced by the Health Minister aim to cut down on wasted appointments and free up phone lines and doctor availability.
We've changed to introduce a sick note line so that if what you want is a sick note alone, you can actually get that by way of a separate line. And we're also calling people as well as texting them to remind them that they've got an appointment with the doctor. This is particularly relevant, or we only do this rather, in the cases of the advanced appointments. So when you booked an appointment a month ago, we will call you the day before to remind you that you've got an appointment and also to ask you if you still want that appointment. And when you don't want that appointment, it's then put into the bank of the general appointments.
I highlighted concerns people have expressed over the potential for abuse of a sick note phone line. Ms. Arias Vasquez said the GHA would have measures in place to prevent their misuse.
What we've actually done is that with the advice of the doctors, we've put in place one clinical safeguards so that if someone does actually need to see the GP, they will always be able to see the GP. There are abuses of the number of times that you can call the sick note line and the number of times that you will be given a sick note. So with the assistance of the divisional lead, we have come up with safeguards in order to prevent abuse and in order to make sure that no one falls through the net.
Now the PCC gets more than 250 calls a day on average, and around 10 to 20% of these, 25 to 50, are people who don't want to come in, who just want a sick note. The hope is that this new process will take those calls out of the system and free up that time for people who want to be seen. And just how much clinical time is wasted due to people missing their appointments altogether.
So over the course of the year, the GHA will make about 146,000 appointments. Out of that 146,000, there's about 5,080 that do not attend. So what we're actually looking to do is we're actually looking to bring down that figure of do not attend, because of course they are taking up GP time. And if somebody doesn't want an appointment, again, we can put that in the general bank of appointments available the next day.
In your press release, you've said that this will come at no additional cost. People will be needing to man the phones to call people and remind them. Where is this manpower going to come from?
So we've got some call operators that take the calls in the mornings, and those call operators during the day were also taking calls for appointments. We found that we're able to free up some of their time in order for them to make the calls to people to remind them of their appointments. And the entire initiative has come at no cost to the taxpayer.
Finally, I asked the Minister if the new system would address the issue of people not being alerted to cancelled appointments if they miss a phone call, as does happen on occasion.
Well, what the system does is that the day before you have an advance appointment, you should get a call telling you that you have an advanced appointment. To remind you so this is the beginning of an ongoing process, and these are the tweaks that we are making to make the patient experience better. So this system should call you to remind you that you've got an appointment, and it should in theory pick that up. However, there are numerous other safeguards that we will be putting in place throughout the course of the next few months in order to make the patient experience that much better.